If you are wondering whether taking medications for your depression and anxiety is right for you, I have something to share. I'm Dr. Ruben Gagarin, and as a psychiatrist, I discuss this issue every day with my patients. But little do they know that I have been on both sides of this conversation. See, my patients, and I usually treat adolescents and their parents, have multiple concerns about taking antidepressant medications. And number one, whether medication has to be taken for the rest of their lives, or their children or themselves become addicted to this medication. Well, I'm going to share some personal experience, and I hope that will help you to make up your mind. See, a few years ago, I went through a rough patch. It was very stressful. I took on a little bit too much responsibility at work. I felt that I had to do it for my team. I had to step up, so I did, but that put a little too much pressure on me. So, as everyone else, I tried to do it the usual way. So I had a couple of glasses of wine with my dinner and watched some movies after the dinner. I was trying to take some time off, but I wasn't really feeling very well. I had some difficulties concentration at work. I was actually angry and irritable, kind of was snapping at people. And once when I saw my family doctor, we actually had a conversation about my weight loss, and then she started asking me questions about my mood, about my function, and so I said like everything was fine. And then she asked me to fill out this questionnaire. It's called PHQ-9. I'm going to leave a link in the description if you're interested. So that questionnaire I do every day. I know the questions. I actually went down in my mind through those questions, and since I never put it on the paper, I never calculated the result, but I thought I'm perfectly fine. So when I actually calculated the score, it was in moderate depressive range. I was actually quite shocked. And then my doctor told me that I should take an antidepressant. So like, what do you mean? Like, I see depressed people every day. And of course, like in my practice, since I work in a hospital in most acute setting, so people with depression who I see, they're quite disabled. And I thought I was doing fine. So just maybe with a little bit of boost, I should be okay. But she was not exactly insisting, but she kind of pushed the issue, kind of, appealing to my rational sense. We discussed various options, and I finally sort of agreed to take Wellbutrin. See, Wellbutrin is kind of unique antidepressant. It doesn't work with serotonin like other medications do. So I picked that medication for myself because I really didn't have a lot of anxiety. And see, anxiety and depression, they're interconnected. In reality, it's probably the same condition. So over 60% of people with anxiety develop, the other way around. Over 60% of people with depression have anxiety disorder as well. So it is probably actually the same condition. So, but I did not have overt symptoms of anxiety. So what I was struggling with is more kind of focus, concentration, energy, motivation, and that what Wellbutrin is supposed to excel at, because it increases levels of norepinephrine and dopamine, and those chemicals tend to sort of boost that energy and motivation. Contrary to common belief, dopamine is not a happy hormone, and neither serotonin nor norepinephrine. There is no such a thing as a happy hormone. Like endorphins can bring some pleasure, but there is no chemical that can bring happiness. Anyway, about that later. So, I started taking this medication, extended release. The generic name is bupropion. So I started with 150 milligrams, and like in a month or so, I bumped it up to 300. And slowly but surely, in about 2 months, I actually started feeling better. My concentration was improving, my focus. I was not overeating as I had been. My sleep was getting better. I continued on that medication for over a year. So, and during that time, I stepped down and passed my responsibility to a more capable person who actually not only was able to do it better, but also was willing to do it, and that is important. I also started journaling. Believe it or not, in my almost 5 decades, I never journaled, and now I'm a big proponent of that because I know how it can be helpful. So I started journaling, and I also started seeing an art therapist. Why would you say art therapist? So that's that's a question for a different video. But my idea was that I actually can talk my way out pretty much of anything, I guess, and I thought that I would just occupy the sessions with talking. So I thought that maybe it would be more helpful to connect with with my emotions through art, and it actually helped a lot. So I had a few sessions, and again, maybe in another video I touched upon how I used AI chatbot to help me to extend my therapeutic sessions. That I use that bot after the sessions for another maybe hour, so basically double the time for the same money. So in any case, so by doing that, I actually did a few things. So while I was taking this medication, it gave me a bit of boost, like a stepping stone, to start figuring out what actually is causing this feeling, this hopelessness that I hadn't had in almost like 5 decades. Well, one, I realized that what I was doing was not really my mission. So for a lot of people to feel that their life is purposeful and meaningful, they should pursue their goals and their values. So, and for me, that is my expertise in psychiatry, sharing my knowledge, knowing, curiosity, etc. And I discovered all of that through journaling. So I realized that what I was doing is actually not what I was supposed to be doing. And the reason why I kind of stepped up, because I felt that I was the right person for the job. The difference is that I'm an expert in psychiatry, not administration or management. So I basically just followed my own script from my childhood, kind of saying that if I'm really good at what I do, I should be a manager. No, that's not true. So this journaling and therapy helped me to actually separate what my script was telling me from what my true kind of values and passions are. So, and that made my choice so much easier. So I basically let go of what was not mine, started focusing on things that were more important to me. I did some research, and eventually I think that decision and the fact that I was taking antidepressant kind of led me to develop Clara's arc. So I'm going to leave a link to my website in the description. So, but importantly, I did not get addicted to Wellbutrin. When I started taking this medication, I had 0 side effects. Maybe I'm unique that way, but judging by my patients, majority don't really have side effects. And I set up a reminder on my phone to make sure that I take it every day, so I didn't really have withdrawal symptoms. Well, Wellbutrin doesn't usually come with withdrawal symptoms, but since I never missed more than maybe 1 pill a month, or maybe even less, I didn't expose myself to that risk. And then when I gradually took myself off, so I tried to go from 300 to 100, and then my mood wasn't so great, so I bumped it up again for a couple of months. So, but I did not have withdrawal symptoms. I had 0 problems letting this medication go. I think one of the reasons why people have withdrawal symptoms, it is not only chemical kind of dependence on the medication, but it is also psychological. See, what I had done is that I did journaling and therapy and adjusted my work schedule, and I ensured that I have support of my family. So I did everything else. So when I let the medication go, I had a lot to fall back on. But if I was only relying on the medication, I would be scared of letting it go. So my point is that medication would never solve the depression completely, but it could be, or it is, a very important stepping stone. Without that, I don't think that I would have done the right thing, like seeing a therapist and journaling, etc. And that helped me to figure out a lot about myself. So I hope this helps. Again, visit my website, subscribe to newsletter if you're interested, and come back for more. Thank you very much. Bye-bye.